Did you know that 80% of all osteoporosis cases are women? 65% of all dementia is women. Women are twice as likely to have IBS, depression, and anxiety. Did you know women die more of heart attacks than they do breast cancer?
What do you oftentimes recommend?
If you're a female listening to this program and you want to be empowered to take back control of your health, then first of all,
hello and welcome back to the Vibrant Wellness Podcast. I'm Dr. Emmy Brown here with my fabulous co-host, Melissa Gentile. Today we are so lucky to welcome Dr. Jyoti Patel. Dr. Patel was named one of the top docs in Phoenix Magazine. She's a fellow of the American College of Physicians and the American Academy of Pediatrics. And she is triple board certified and practices integrative pediatrics and internal medicine in Scottsdale, Arizona. If that was not enough, Dr. Patel is also certified in functional medicine by IFM and is a Chopra certified Ayurvedic lifestyle practitioner. As an integrative functional medicine doctor, Dr. Patel's mission is to transform health and beauty inside out, meet her patients where they are, and empower them with knowledge so they can take back control of their health and lives. Let's welcome Dr. Patel. We're so happy to have you, doctor. How are you doing today?
thank you so much for having me. I'm having a wonderful day. How about you?
It's going well. It's Friday. Happy to be here. This is such a nice way to close out the week. I'm excited for this conversation. So I'm going to kick it off with the first question. Dr. Patel, your journey into integrative and functional medicine began with a personal health challenge. Can you share that story with us a little bit and how it influenced your professional path?
Yes, thank you so much for asking me to share my story. Sometimes it's nice to hear that, even doctors have their own, journeys. And in my life, I was in my 20s when you think life is invincible and everything is going to go in your direction. I was striving, driving, working very hard, completing 2 residencies at the same time. And unfortunately, in my third year of residency, I developed cancer. And I'll tell you the story because it'll make sense to a lot of the audience members that may have ignored their health. I was pregnant at the time with my son, and I went to see my OB, and he recognized that there was a change in my neck and asked me to get it checked out. But I was so busy and I was completely exhausted, didn't have time to care about it or think that there was anything wrong. I was in my 20s. What could it be? So every time I went in to see the OB, they would say something like, "Oh, did you get that neck checked out?" I'm like, "Yeah, it's all fine." But I really couldn't give myself permission to truly take care of myself because everything else, work, family, priorities came before my own health. So it went on after 9 months of delivery. Now I had, a large mass in my neck, which was very visible. But in my own mind, I could not grasp the idea that I had to do one more thing for myself. I just had a baby. I was working hard. I wanted to finish on time. I didn't want to show up small, and I didn't want anyone to say that I wasn't good enough. So again, ignoring my health, I was curbsiding doctors in the hospital to see if anyone would tell me what it is. Eventually, one doctor, who I still value the most, pulled me aside, made me make an appointment, come in to see him officially as a patient, sat down with me, did an exam, asked questions, ordered my proper tests, and did my biopsy to only tell me that I was diagnosed with cancer. And it was still devastating, but still not a reality for me. Again, a lot of warrior women out there can relate to the fact that we pretend like this isn't affecting us, that we can still carry on, that we're strong enough, we're going to get through this. And the world tells you that. "Oh, how strong are you? Look, you can get through anything. You're so brave." And so that gives us permission not to be vulnerable, not to take time for ourselves, not to slow down. And I did the same thing. I got the surgery, got the radiation, graduated on time. I thought that gold star meant that I was good enough. I took on a toxic job, working, 90-hour weeks, hospital and outpatient. And I still didn't get the memo. I got another recurrence and metastatic disease and another recurrence, more metastatic disease. But I didn't slow down because I didn't make the connection between my poor lifestyle, my high stress, my bad nutrition, my stress and my sleep practices, my toxic job, my environment that was pushing my health in the wrong direction. As a physician, I did not make the connection until I did. And so that's kind of where my journey with integrative and functional medicine started, is starting to reflect. I quit the toxic job, by the way.
Yay.
And it was an interesting story. I had a female supervisor, I had a female physician who was in charge. And I'd asked her if I could leave the clinic by 6:30 because my 1-year-old's daycare closed. And she looked me in the eye and she said, I can't promise you there won't be ill will between you and I if you leave and I'm still working. So again, even as a culture, we don't give people permission to be sick. We don't give them an allowance to take care of themselves. We find that there's shame and judgment in that. And I decided in that moment that not only was I going to take better care of myself, but I was going to drive my practice and my values and my belief systems to treat my patients in the same way. Not only that, but my staff and the people who work for me were never going to ever feel like they weren't a priority. So I think it really did a complete 180 shift. I think in medicine, we become arrogant and we become disconnected from a patient's plight. And for me, being in the hospital, having to be vulnerable, wearing a hospital gown, going through anesthesia, going through surgery, puking my brains out after surgery because of the anesthesia, just understanding what a patient feels like, how it's so scary to not have answers, how it's scary to not feel like you're in control. And now, even though it sounds like, it was a tragic story, it wasn't. It was the best thing that happened to me because it made me who I am today. 20 years in practice, I still have stuck to that same paradigm that every person that walks into my exam room is a person and they require my undivided attention and compassion. So anyway, that's my story.
Turning your pain into purpose here. And I thank you for sharing that, because I think your entire experience and your journey here is so symbolic of what a lot of women are kind of going through, and kind of just what we're going through as a society with the pressure and careers and just really all the stress that we're kind of going through day to day. And we're really kind of trained and programmed to put our health and our well-being and our minds kind of to the side and put everything else first. So, I mean, with that being said, like, what are some of the diseases that you're seeing now in practice that are prevalent in women?
So that's a really good conversation to have, Melissa, because unfortunately, because medical science, clinical trials and studies are based primarily on men's physiology and men's conditions or interests, women's health sometimes takes a backseat. Not only that, but a lot of the data is extrapolated to women. But now that we're studying women more, we recognize that we are not little men, that we have completely different physiologies. We have different disease states. We present differently and require different medications, different dosages, and different therapeutics. So I'm excited that we're in this new era of looking at women from so many different angles, especially with medicine. So let's talk a little bit about some of those diseases. Did you know that 80% of all osteoporosis cases are women? 65% of all dementia is women. Women are twice as likely to have IBS, depression, and anxiety. Did you know women die more of heart attacks than they do breast cancer? So it's so prevalent for us to just not even talk about it. When a woman goes into a doctor's office and they have fatigue, or they have nausea, or they have shortness of breath, does the doctor automatically think cardiovascular disease? No. Unfortunately, that's how they present. So we are programmed in medicine to think that cardiac disease means crushing chest pain. But I'll tell you a little story about my mom. My mom is 72, and she presented with back pain. She had pain where her bra strap touches her back. So they automatically thought, oh, get a spine x-ray. It's probably an osteoporotic fracture or something else is going on. She had a 99% occlusion in the artery going to the back of her heart. She needed a stent. So if we're not looking at women through a different lens, we're going to miss a lot of women with dementia, with autoimmunity, with gut issues, with heart issues. So it's so important to know that women not only have higher prevalence of certain diseases, Again, those are, when we look at things like autoimmunity is 80% in women. 65% of all dementia patients are women. Women are 2 times more likely to get Alzheimer's disease than men. We have twice as much gut issues than men do, IBS, and we're more likely to be diagnosed with depression and anxiety. So we really do need to focus on a few things when a woman comes in the door. And so if you're a female listening to this program and you want to be empowered to take back control of your health and be an advocate for your health, then first of all, make sure that you're going in and asking the right information. So I always empower women to say, okay, get the full comprehensive tests. Women tend to not get full cardiac panels, tend to not get full hormonal panels. And if they do suspect heart disease, they're less likely to get stents and angioplasties and heart bypasses than men do. So it's really important for us to ask the right questions.
Absolutely. Yeah. And those stats are staggering. So thank you for sharing those, Dr. Patel. It's just shocking. And I loved what you said earlier. You said warrior women, and we all know what that means. I mean, the pressures are immense to be everything and do everything and live up to these expectations. And of course, you touched on, of course, our unique physiology as women. But beyond this, these differences between men and women, what's at the root? Can you speak to what's the cost of being a warrior woman in today's society?
Yeah. So again, it goes back down to our hormonal axis. Women have different physiologies when it comes to hormones. We know that we cycle circadianly. We know that we cycle through the month. We even cycle seasonally. And we're very different than men when it comes to that. And our HPA axis is actually different. And we are more sensitive to stress. We're more sensitive and more reactive to stress. Primarily is because it's a survival skill that women have developed over time, where we have a sixth sense about things, that spidey sense when we know something's wrong. That's because we're very intuitive. And women's intuition can be sometimes seen as a negative, but it's actually one of our gifts. So yes, we can talk about the diseases that are more prevalent in women, but we also need to talk about the gifts that women have that men don't have. And so when we talk about autoimmunity, and we talk about hormonal axis, and we talk about gut health, women are very different when it comes to their physiology, when it comes to those 3 things. So let's break it down. Our HPA axis. Our HPA axis is our hypothalamic pituitary adrenal axis, but it's also our thyroid axis and our gonadal axis. So when we are in stress states, and we talked about being a warrior woman, that high cortisol, foot on the gas pedal, from the time we get up to the time we go to bed, causes extreme inflammation in the system, because high cortisol leads to high inflammation. High cortisol leads to dysregulated blood sugar, elevated insulin, increased visceral fat, so that belly fat goes up, exhaustion goes up, mental exhaustion goes up. We become more fragile when it comes to our mood. We become more depressed, anxious. We lose our ability to have willpower. We seek some maladaptive habits such as food, sugar, alcohol, substances to keep us going, caffeine. We start to self-sacrifice the habits that we should have for the things that we need in the immediate to get us through the day. How many of you are guilty of that, right?
Especially the caffeine.
Right? Yeah. We are, because we have this high standard that's set for women. We are required to live up to the standard at all times. So this constant drive or overdrive of the HPA axis causes dysregulation for us, especially because we have this hypersensitive visceral system to our brain, to our heart, to our blood pressure, to our blood sugar regulation, and our gut health. So that's step 1. We're driven to have this hypervigilant immune response and stress response and gut dysregulation when we're highly stressed.
Since you see so many patients and so many women that are kind of struggling with this same underlying issue of really high cortisol, what do you oftentimes recommend? Is it, nervous system regulation practices? What are some of those tangible things? Maybe just a couple of them that we can kind of take with us.
Absolutely. So vagal toning, if you've heard about the vagus nerve is cranial nerve 10, and its main function is to get us back into balance, back into the flow. And now that nerve originates in our brainstem. And so the first exercise that I would teach you, Melissa, is is bee's breath. There's a point
Bees
on
breath. Okay.
yes, there's a point on the inside of your ear. So you don't have to do it now if you don't
Oh,
want
I
to.
want to.
Place it
I want to try it.
Before I forget.
and then hum. And if you hum while you close off your ears, you will feel a vibration through your entire sort of system. That humming sound creates a vibration that activates the vagus nerve. So if you're in a stressed state, put your fingers in your ears and start humming like a bee. Okay.
That's a new one for me. That's fantastic.
Mm.
And
Oh,
so
good.
easy.
Bee's breath. Very good. It creates both sound, vibration, and activation of the vagus nerve. And at the level of the vocal cord, it's activating the vagus nerve. Okay. So singing, gargling, humming, chanting activates the vagus nerve. Now, second is your eyes. So when you're in stress mode, you become myopic. Your vision is center focused. So if you are looking at your computer and you're completely exhausted, I invite you to look around the room, changing your focus to a panoramic state, looking further away, looking up, looking to the side of the room, tells your brain that there's not a bear sitting in front of you. So there's no need to go into fight or flight. So when we change our gaze, we change the trajectory of what our brain thinks is happening. The next place that you want to activate the vagus nerve is your nose. Nasal breathing. Alternate nasal breathing is an Ayurvedic practice, a pranayama practice. It's called Nadi Shodhana. And doing alternate nasal breathing activates the vagus nerve, again, relaxing the system. Now, it doesn't have to be alternate nasal breathing because that's weird if you do it in a meeting. But you can also do finger breathing. So taking your finger and sliding it up as you inhale, and then exhale, and inhale, and exhale. And you can do this with your hands below the table.
Right.
So that way the person in front of you doesn't know that you're vagally toning because they're irritating you. Okay,
I
so
love
placing
that.
that hand underneath and just breathing in, breathing out. You're doing diaphragmatic breath, belly big when you breathe in, belly small when you breathe out. Push the navel out as you inhale, pull the navel in as you exhale. So simple practices. If you're alone and you're trying to, again, vagally tone, you can simply tap your forehead, your face, your cheeks, your chest. You can even do a Tarzan tap and start, vocalizing as you're tapping. That again helps decrease the stress in the system. You can get up and shake your body out. Again, if there's a bear in front of you, you would not be doing that, right? So it's
It's like
sending
when animals shake when they're scared or, they go through a traumatic experience. And we don't do that as humans.
because we've put shame attached to fear, and we've put shame attached to sadness, right? So we don't allow people to cry. We tell them to stop crying. We do that at the level of 2-year-olds. When a toddler's throwing a fit, we quiet the toddler. We reward them for being quiet. We tell them they're a good person if they're not crying. We punish them. We put them in the corner if they're crying and they're upset. So we're very early training ourselves to stifle emotional release and reward this fictitious barrier or this shield that we put up in front of ourselves to protect ourselves from vulnerability. Isn't that interesting?
It's so
wild.
profound.
Yeah.
The other place where women are different is their immune systems. So women actually have a very active immune system, more so than men. And we are more apt to fight off infections. If you've ever heard about a man cold, women are more apt to have more resilience when it comes to fighting off infections. So that's our gift. The unfortunate backside of that is that we're also more prone to autoimmunity. 80% of all autoimmune cases are women. So this is lupus. Lupus is 9 times more prevalent in women than in men. And that's because our immune systems tend to be a little bit more hypervigilant. Now, you as functional practitioners may know this, but if you're an audience member that's not familiar, 70% of your immune system resides in your gut. 70% of your immune system resides in your gut. It's called the gastric associated lymphatic tissue. And it lives one cell layer beneath the lumen of your colon. So the colon is the opening and the lumen is the lining of the colon. And your immune system lives one cell layer beneath it. So when you have gut issues and you have immune issues, that in fact creates the perfect storm for autoimmunity.
Yeah, that's a really good point that you brought up. And because I always believed or was thinking, just, kind of out of thought, is that I thought it was more an emotional piece to it. Like, oh, maybe because we're more emotional, more sensitive, maybe that's why there's more prevalence in autoimmunity in women. But I didn't realize it really is a physiological, biological difference as well.
Yeah, and women are 2 to 3 times more likely to have IBS and gut issues. Our colon is 10 centimeters longer than men. We have a longer redundant colon. We have also poor vagal toning when it comes to that. And we have hypervisceral sensitivity, more hypervisceral sensitivity than men do. So the biology of it puts our gut at more peril when it's dysregulated and makes us more inclined to develop autoimmunity because our tendencies for leaky gut and food sensitivities and poor vagal tone is unfortunately greater. So that is the disadvantage of having, the systems that we have. So how do we balance that? It's really important for women to be advocates for their health and understand that we are at risk for certain diseases more than men. And if we have symptoms, to advocate for answers from our clinicians and to seek a second opinion. Oftentimes, if you go into a clinic and you get somebody who is not compassionate or not understanding or dismissive or condescending, then really is to understand that, yes, that person is not the right person for you, but yes, you also deserve answers. A lot of times women want to be polite. They don't want to rock the boat. They think that the authority in front of them knows more. And so they become quiet. They start to embrace shame around the questions that they may have asked or the condition that they have. And if they get dismissed, sometimes they're okay with the answer that nothing is wrong. I'll give you an example. So I saw this lady just today earlier. She had symptoms of a TIA. She didn't feel well. She had had a TIA before. She's in her 70s. She had a TIA before and she didn't start to feel well. She was looking confused. She looked pale. She was looking like she was going to pass out. She became confused. She wasn't able to put things together. The EMS arrived. They took her to the emergency room. They admitted her. The specialist that came to see her, unfortunately, dismissed her right away, told her she wasn't having an issue and that she's completely fine and she just needs to go home. And unfortunately, what happened with that woman is she embraced that as the truth. She's like, okay, well, the doctor said nothing is wrong. Lucky for her, her daughter-in-law was younger and did not take that for the ultimate truth and asked me to give her a second opinion, another neurologist to go to. So I do want to empower women to not be marginalized or dismissed. If you truly aren't feeling well and you know something's wrong, find the right clinician to connect with you and ask you the right questions.
And on that note, Dr. Patel, I wonder, because your background is so versatile, I imagine there are some unique points in your intake process. So I would love to know what's unique about a first visit with you.
So I have the luxury now of doing a more comprehensive functional exam on my patients, which I absolutely love. So I always start with the tools that I learned through functional medicine, and I ask the patient to tell me their story. It's so important before you start asking questions, you give the person a chance to tell you their story from the beginning. When was the last time you felt amazing? When did things turn? What was the perfect storm of events that happened that caused the shift? So asking them to narrate their story and then reciting it back so that they know you heard them.
That's
And
huge.
then isn't it though? We all want to be heard. We all want to be understood. And once you set the grounds for a good relationship there, the next step is to start from the beginning. The antecedents, all going back to their prenatal history. Again, I practice both internal medicine and pediatrics, so I'm used to getting a extensive prenatal, perinatal history, but I like to get that even with my 80-year-olds. I know it sounds strange, but you'd be surprised how much information you can derive from someone's prenatal, perinatal, and childhood history. Important to ask about childhood trauma. Again, it's a very vulnerable topic. People are unable to share a lot. So you do need to set the grounds for trust and, and give them the space and time to share with you in their time. But looking at childhood trauma, and you guys are probably familiar with the ACEs trial, so the Adverse Childhood Events trial. They found there was a study in the 1990s done by Kaiser Permanente and the CDC where they conducted a survey of 17,000 adults, and they asked them 10 questions about childhood trauma. And the more you said yes to, the higher the propensity for chronic disease as an adult.
Mm-hmm.
So it could be anything from autoimmunity, heart disease, diabetes, cancer, addiction, depression, anxiety, suicide. The rates tremendously, exponentially increase if you suffered from childhood trauma. So it's so important to get the full story. Getting a thorough past medical history, which includes not just their, their medications, but their supplements and their vitamins, and getting some interesting history about their family and their social dynamics. Where do they live? Who do they live with? What's their stress level like? Do they love their job? Do they hate their job? What do they love? What are they passionate about? What are their mind-body practices? What are their wellness practices? I get a 3-day food journal. I ask them to describe their exercise habits, their sleeping habits, and I tell them it's a no judgment zone. So tell me everything because I really want to know what your life looks like. I want to live in your life for a minute and see what I see.
Safe space.
And then, and environmental exposures as well. So whether there's exposure to mold or heavy metals or tobacco, or they work in an industry where they may have been exposed, all of it is relevant to their health.
And can you touch on women's mental health and physical health and kind of how that changes during different life stages? Because I think we're all pretty familiar with going in as a woman and you maybe have some complaints about fatigue, or maybe you have insomnia or something like that. And maybe you describe that you're feeling kind of anxious and it just gets written off as anxiety, or you get a referral to psychiatry, when really there can be a more like biochemical issue going on. Can you speak to that a little bit?
For sure. So we do know that there's many, many reasons why the mind-body balance can be disturbed. One is the gut and the brain axis. So oftentimes, and you're familiar probably with this, but 90% of serotonin is actually produced in the digestive tract, and 50% of dopamine is produced in the digestive tract. So oftentimes, if somebody's just dismissed and given an SSRI, which is an antidepressant for their symptoms, we're missing the upstream root causes of why somebody might have this imbalance in their mood-body balance. Another one is hormonal imbalances. We know that as women travel through different stages of life and they start to have shifts in their estrogen, progesterone, testosterone balance, it can in fact cause a myriad amount of symptoms. And it doesn't have to be that classic hot flash, night sweat 50-year-old. It can start as early as your 30s, right? And you can start to have changes with your menstrual cycle. You can have changes without changes in your menstrual cycle. You might find yourself more fatigued, having more ups and downs with mood, having more joint pain. You may have unusual symptoms of aches and pains in weird places. And those all things can be a symptom of hormonal dysregulation. Younger women need to start thinking about PCOS, polycystic ovarian syndrome. Again, in medicine, we were taught that the classic PCOS patient was an overweight female with abdominal striae and acne and facial hair. That is not true. I have seen so many women that are drivers, 20, 30-year-olds that are hitting the gym, doing HIIT workouts and CrossFit and macro managing, and then doing high-powered jogs, having fertility issues, early ovarian failure, and PCOS. So again, going back to that HPA axis, that hormonal pathway, oftentimes you can get hormonal dysregulations that can cause mood symptoms. So it's really important to look at that history as well. So omega-3 fats and B vitamins and magnesium, so many important things that we're now nutritionally deficient in. And there's some amazing prison studies where they've taken people that have been incarcerated for high violent crimes. And all they've done is done a nutritional replacement with an omega-3 fat and a multivitamin. And they've shown this in multiple studies that it decreased the violent crime rate
Wow.
in those divisions. So if you think about nutritional deficiencies in our children, in our adolescents, in our young teens, right? We're eating highly processed, ultra processed foods, and they're deficient in so many vitamins and minerals. And not only that, but they're inundated with so much fillers, dyes, preservatives, chemicals, artificial ingredients, causing havoc to their mind brain gut axis. In European nations, they have banned certain colored dyes because they put a warning on the box that it causes behavioral changes in children. Unfortunately, we in the US are a little bit less vigilant when it comes to what we feed our children and ourselves. Don't you agree?
It's like not even food anymore. It's just it's just a long list of, 20, 30, 50 chemicals on children's food packages now. It's just
Well,
it,
don't
it
eat that
blows
way
blows my
too.
mind.
It's
Yeah.
everybody.
Yeah. Like
They've
you're
done,
so
they've
right
done,
there.
they've done some interesting studies on fecal transplantation in people with bipolar, schizophrenia, anxiety, and depression. And we also know that that plays a role. So your gut microbiome, if it's dysregulated, if you have dysbiosis, if you have an imbalance or overgrowth of bad bacteria, that in itself may be the root cause of your mood balance. Isn't that interesting? That you can actually reverse some of these mental illnesses that we incarcerate people for or we institutionalize people for. It can be reversed just by changing their gut health.
Yeah.
And I did want to backtrack just a couple minutes. You were talking about just being more aware of conditions like PCOS and kind of starting to think about that even when you're a little bit younger, like in your 20s. What are your thoughts on just the prevalence of birth control and synthetic hormones? And, when these younger women, they go in for PMS or irregular cycles or maybe some PCOS symptoms, they're put on the birth control pill for 2, 3, 4, 5, 10 years, and then they come off of it. And it's really like that symptom was like a greater issue. What are your thoughts on that? And how can we kind of avoid falling into that trap?
So, as a medical doctor, I still believe that there's room and a role for prescription medications for hormonal management because I have had to treat women with severe PMDD, severe PMS symptoms, or really troublesome PCOS that requires hormonal balance. So until we can fix the underlying root cause, whether it's estrogen dominance with endometriosis or it's androgen dominance with PCOS, whatever the underlying root cause is, until we are able to allow that body to balance in the right chemistry, sometimes it's important to give women the tools, including prescription medication. The biggest mistake a lot of times clinicians do when women come in that are older and they're going through perimenopausal symptoms is they say, that's just part of life. You just need to suck it up and deal with it. And so it's again marginalizing women and telling them what they're feeling and how they're feeling is not important enough to require treatment. So I feel like women's health should be nuanced. It should be individualized. And every person walking in may need a hormonal pill to help them with their symptoms while they have a compassionate physician willing to work with them on finding out why things are out of balance and what they need. So even when it comes to my postmenopausal women, I do prescribe bioidentical hormone replacement therapy because I feel like there's now good evidence that we're living longer and that the use of bioidentical hormones may, in fact, decrease our risk if taken early, between 50 and 60, within 10 years of menopause. We can cut our risk for having a heart attack by 50%. Isn't that impressive? So this big misnomer that estrogen causes cancer has been debunked, and we know that's not to be true. In fact, in the studies where women were given estrogen alone, it lowered the risk of breast cancer by 45% in that cohort. So we know that there's evidence that hasn't been sexy enough to put out into the public that indeed, if women come to you and have hormonal imbalances, there may be a role for bioidentical hormones to help prevent Alzheimer's, prevent dementia, prevent osteoporotic fractures, prevent heart disease. And the statistics for osteoporosis are incredible. 80% of all people with osteoporosis are women. And if a woman suffers a hip fracture, the mortality rate in the first year is 20%. A woman is likely to die, 20% likely to die within 1 year of a hip fracture. So my nuance with that is if I think a woman would benefit from hormone replacement therapy, then I will prescribe more bioidentical treatments to help them navigate their health, giving them the information and the power to say yes or no. That's the other thing that all happens in medicine a lot is we are very dictatorial when it comes to women's health. So I like to invite women into that conversation. So I would say to you, Melissa, what is it that you want? What are some of the concerns you have with hormones? And what are some of the things that you want to fix today that we can work together on? And if you said to me, look, I don't want to take hormones, I want to do this naturally, I'm like, I am your partner here. Let's do it. And then we will work on your HPA axis. I would teach you how to do breath work and meditation. I would invite you to work on your circadian rhythms and your infradian rhythms. I would work on your gut health with you. I would help you navigate the environmental toxins you might be getting in, those xenoestrogens, those foreign estrogens from your skincare and body care products and your household products and your kitchenware. And we would just sort of work gently to getting you in the flow without doing anything that's against your own values. How's that sound?
I mean, that sounds amazing. I love that you invite in the patient to kind of bring their intention into the space instead of just saying, this is what I believe, this is what we're going to do, this is the medicine you're going to take, or this is the natural route we're going to take. I love that. You're empowering the patient here.
It's true. Your approach, Dr. Patel, is truly integrative, and there's a time and a place, as you so wisely said, for medication, and understanding what are the patient's goals. Is this good for your goals or society's expectation, or especially if it's in terms of preventive and wellness. There's so many things that people see online. Should I take this? Should I take that? Is this good for me to eat or bad for me to eat? And I say, for what? Within what context? So that's so important, and I think super helpful. So thank you for that. And I'd love to know, as you bring up bioidentical hormone replacement from a functional medicine perspective, how are you monitoring those patients? Do you like to order urine hormones, for example, to look at metabolites? Because if we are doing things a bit more comprehensively, I imagine you're assessing those patients more comprehensively also.
Absolutely. And so I think that that's the key to a skilled practitioner is to, one, look at the nuance of the patient, but also to do close monitoring. So oftentimes patients will go to some of these clinics where you just go in, get pellets and leave, and they'd have no supervision and no monitoring and no assessment of risk. So these are dangerous practices. So it's really important, if you are going to go to a clinician, that you ask for the right testing. So when it comes to hormonal testing, I like to do a full comprehensive panel. I do serology and urine. So I do look at urine metabolites to see how the estrogen is being broken down. And I also like to make sure that I appropriately replace hormones so that I'm not over medicating. Sometimes I'll get patients that are taking 2, 3, or even 10 times the amount of hormone that they need. They'll come in with testosterone levels over 500. And I'm like, whoa, that's a lot more than you need, honey. So that's where we have to really start testing our patients and making sure that they are appropriately managed. So a full comprehensive panel when it comes to sex hormones, looking all the way from the FSH, LH, pregnenolone, looking at DHEAS, looking at progesterone, estradiol, and testosterone, and it's a breakdown to DHT, especially if women are having hair loss, just to make sure that we're not getting too much androgen excess. Also looking at the metabolites and making sure that the liver is methylating and processing those estrogens correctly. I tend to do more transdermal estrogen at this point just because it's found to be safer than oral estrogen replacement in terms of hypercoagulability with women. So tend to do more patches and rings and creams for the estrogen and oral progesterone, and then topical testosterone. Along with just doing the sex hormones, it's also really important to get other hormones checked. I do a fasting insulin. I like to see that less than 5. I do a hemoglobin A1C, look for less than 5.5. And, again, if you have the means, you can check for 4-point salivary cortisol testing to look at cortisol throughout the day. And you can even get a test where you check for your melatonin levels to make sure that they're rising appropriately at night to get a good night's sleep. So looking at the whole gamut of hormone testing when I'm seeing women in my clinic.
You don't realize how crazy your cortisol is until you take one of those salivary tests and see it going off the charts throughout the day. So I think it's such a good test. I think for people who just need to see that black and white, they don't believe, how hard their body is actually working, how hard their adrenals are actually working on a day-to-day basis.
Absolutely. And something quick that I teach my patients is if they have an Apple Watch, there's a free app called AI Stress Monitor.
Ooh.
And it has a paid version, but it has a free version that's just enough. But it measures your heart rate variability. So moment to moment, if you're in a stress state, my phone will light up and it'll say overloaded.
Ooh.
So in real time, it's giving me feedback that I need to step away from my computer, that I need to take a deep breath, and I need to get a drink of water. So it'll tell me if I'm doing great, or it'll tell me if I'm getting there or if I'm overloaded. So it gives me a HRV monitoring on a regular basis. So I find that these smart devices can be used to help us navigate our stress levels as well. I put a CGM on, like a continuous glucose monitor. And interestingly for me, when I sit down in front of my computer, my blood sugar is 10 points lower than after 2 hours of work. So just the stress of me sitting causes my blood sugar to rise. If I don't get a good night's sleep, my blood sugar is high the next morning. So we as women respond differently when it comes to stress, cortisol, insulin, blood sugar regulation, inflammation, gut dysregulation. I'm more sensitive to constipation when I travel than my spouse, right? Because our vagal tone is a little bit too hypersensitive to change. So understanding these are our signals. When I get constipated, it's a signal. When my HRV pops on my watch, it's a signal. When my blood sugar goes up, it's a signal. So part and parcel of this empowerment is teaching women how they can use these signals to then balance the system. The body wants to be in homeostatic flow. It wants to be in the center midline. And when we are driving, and we're 90% neck up, we are ignoring the body. And we're allowing it to be in a chronic state of stress and inflammation and disease. So when you start to look at these barometers and you start to see that your HRV is dropping, your blood sugar is rising, your stomach's feeling queasy, your chest is, not feeling great, it's tightening, your breath is shallow. So I'm going to ask you two ladies right now, when was the last time you took a deep breath?
It has to be a proactive thought. I can't tell you,
I have to schedule time in. Like in the morning, it's like, all right, before I start work, before I sit down, it's like you have to schedule it or, kind of. Yeah, like it's not
barometer of stress. When you stop breathing or you're shallow breathing, that's your HRV dropping. Wow. That is your signal that you need to take a deep breath and you need to get back into the parasympathetic. Okay. So awareness of the body is the first step. Awareness of your breath. So if you notice you're constricted, your jaw is tight, your fists are tight, your belly's tight, your neck is sore, these are signs that you have been in fight or flight. And so it's your job to then navigate the ship to that parasympathetic ocean by taking deep breaths, by taking a walk, taking a sip of water, getting food to eat, nourishing your body, all the things that we've just talked about.
Setting boundaries. That's a whole nother episode, right?
We're all horrible at it because our self-worth is tethered to our doing.
And Dr. Patel, you kind of just touched on this, but I did want to ask you kind of before we close here is what other advice would you give to younger women or to help them prepare for a healthier future? Is it something as simple as a supplement, a certain test, or even just these parasympathetic practices?
It's all of it. So it's important to gather information. So be an advocate for your health, get the right tests, get a full comprehensive cardiac panel, include hormones, look at micronutrients, look at your gut health. I think that's a really good test that gets overlooked a lot, but I find a lot of value in that. And if you are worried about environmental exposures, get tox testing to see what your exposures are. Become empowered with knowledge so that you can then take control. Maybe wear a continuous glucose monitor for 10 days. Maybe upload the app on your watch. Do things to help you figure out where the imbalances are. And then use all the tools you already know. Get up at the same time, go to bed at the same time. Get 15 minutes of sunlight in the morning. Start and end your day with meditative practices. Think about ending your day with journaling and gratitude and starting your day with intention setting. Make time for breakfast, lunch, and dinner. Try not to eat in front of your technology, in front of your laptop, in front of your phone, in front of your TV.
That's a
Right?
hard one.
Right?
Yeah.
Priority. Eat and chew your food. Choose your food wisely. Ask yourself, what does my body need, rather than what emotionally do I need to satisfy myself with? And then drink your water. And then move your body. And it's not important to go 30 minutes in the gym. What's more important is that you're moving all day long. So another tool is check your watch, see how many steps you're taking. If you're reaching less than 5,000 and it's dinner time, you need to up your game. So tomorrow I want you to get to 6,000 steps. The next day I want you to get to 7,000 steps, and then keep going from there to keep yourself physically active. And then connect with your friends and family. Social isolation is one of the worst health detriments out there. And we found that out through COVID. So I do ask my young women, find a tribe of like-minded women that love to do what you do, that bring you up, that lift you up, that don't talk about you behind your back, aren't toxic, aren't passive aggressive, aren't trying to challenge you or compete with you. Try to find women that are like you, that can help you grow as a person. Find a mentor. Find a mentor who's doing it right. Maybe she's a decade or two ahead of you and she's figured it out. And maybe she can help you also figure it out. So again, this is a collective, right? We will all want to be well. We all want to be happy. We all want to be balanced. So that's what I would tell the younger women.
I have to ask Dr. Patel, do you offer mentorship to maybe female physicians or medical students? Because your message couldn't be more timely and moving.
I've been a preceptor at the medical school for 20 years. So I take on medical residents and medical students. I teach here at the University of Arizona and at Banner, their residency program. So I take on that role as a teacher and as a mentor for people in my profession, because I know how important that is to give back. And when I have medical residents rotating through my clinic, I specifically tell them, don't get bullied. Don't get shamed when you need a day off, or you're not feeling well, or you had a bad outcome and it's affecting you emotionally. Allow yourself to be vulnerable and take care of yourself. So by mentoring that, by showing them how to show up, how I live my own life, these are the ways that I can then teach.
I just want to scream your message from the rooftop and spread the word. There needs to be, this just needs to be spread all over, because it's so true. You're speaking to me. And especially for our female listeners, I don't think we've had a conversation quite like this. We've touched on so much.
Yeah, it's really coming straight from the heart, and it's resonating deeply. So thank you, Dr. Patel. If any of our listeners tuning in today, if they want to connect with you, if they want to look into, I know you have a lot of great resources. I saw on your Linktree, and you do a lot of content creation of educational content, or if they want to work with you as a patient, where can we find you?
So my website is my practice. It's aimsforwellness.com, AIMSFOR, wellness.com. And if they just want free information, they can join me on my social platforms. On Instagram, I'm Dr. Jyoti Patel, MD. On TikTok, it's just Jyoti Patel, MD. And, they can watch my YouTube channel. I do a lot of educational postings there. I do a free webinar on the first Wednesday of every month on different topics. So people can join me for everything that I talk about. And the upcoming one is going to be cardiovascular disease. So this week was women's health. So, so anytime I have a webinar, you are more than welcome to join.
Amazing. I'm definitely going to be jumping on those and moving forward. I'm so happy that you put out so much free educational content. It's so important. And again, thank you so much for just taking the time today and speaking your message. I know it's resonating with myself deeply, and definitely is going to resonate with a lot of our listeners. I can't wait to air this episode. And to everyone tuning in today, until next week, wishing us all vibrant health and wellness.
Thank you for having me.
Thank you so much for being here today. Don't forget to leave us a review and subscribe so we can continue to pay it forward together. And remember, the key to longevity is knowledge. Keep learning, growing, and tuning in to the Vibrant Wellness podcast to discover the latest insights and strategies for optimal health. Join us again next week. Just a reminder, this podcast is for educational and informational purposes and is not a substitute for professional medical advice, diagnosis, or treatment. The views expressed by guest and host are their own and do not necessarily reflect the official policy of Vibrant Wellness. As always, consult your healthcare provider before applying any recommendations that you heard here today.